Greetings, I'm Dr. Vanessa Allen from Natural Family Wellness, located in Glendale, Maryland. And today we're going to continue our talk about exercise. We talked about the benefits of exercise to include lowering your blood pressure, increasing your cardiovascular health and cholesterol and diabetes, and how to get started. So to get started, you want to choose an exercise that's comfortable for you, whether it's walking, dancing. I recommend doing a variety of things. Don't do the same thing over and over again. Then you'll put yourself at more increased risk for stress injuries, and then you can't exercise at all, and you'll have a get back in shape again. So when you get started, your goal might be to start out with 15 minutes a day if you've never done anything, and then you can increase that 15 minutes twice a day with a goal of getting up to about 20 to 30 minutes of physical activity a day. And in order to see some benefits from exercise like weight loss, you want to burn more calories than you consume. So you want to see about a 300-calorie deficit. So if you're recording your physical activity versus how many calories you consume, you want to have about a 300-calorie difference per day, and this adds up over a week, and then you'll get to see the 1 to 2 pounds of weight loss of 5 pounds a month. So some of the things you want to consider, we talked about the different types of exercises you can do. And as you increase, you start out like maybe 3 times a week with the goal of getting up to 5 to 6 times a week. So maybe you might do some aerobic type physical activity about 3 times out of that week, and then add on the strength training maybe 2 to 3 times a week. And then also commit, especially as you get older, use a day like for yoga and Pilates for stretching and strengthening, which helps you with balance. Then evaluate the types of shoes that you're wearing or the type of activity that you'll be doing. You want to have a broad-based shoe and one that gives you extra support. And just because your shoe looks brand new, you do have to replace the shoes. So if you always exercise indoors and your shoes look brand new, try to change them about every 6 months, especially if you've gotten yourself up to where you're using them every day. And then assess your flexibility. So especially if you haven't been used to using exercise, see if you can flex your foot forward and backward, or especially if you're going to start a walking program. How about your flexibility as far as like reaching your toes? Are your hamstrings stretchable, your quads? And check for balance. So if you're kind of unsteady on your gait, maybe you need some assistance as far as a cane or some other type of program as a more structured environment. And then when you include your warm-up, you want something to get your heart rate up. You don't necessarily want to stretch, but you want to increase your heart rate, so doing a walking activity at a brisk pace. And then when you're cool down, you want to cool down for about like 5 to 10 minutes afterwards, and that's where you stretch, whereas you stretch out your quadriceps, your calf muscles, your thighs, things like that. And then also include your upper body type exercises too. So things like your muscles, like your biceps and triceps, make sure you stretch out those areas as well. And of course, during this whole time, you want to stay hydrated. So make sure you take a water break. And then to assess how well you're doing, you should be breathless. If you're walking with a friend and you're talking and talking, that's probably not pushing yourself as well as you could. You want to be breathlessly like, and that shows that you're working it out. And if you met that goal already, push yourself a little bit further so that you can increase your endurance and burn more calories. So if you've been doing the same level of activity for maybe a month or two, take it up to the next level. So if you're on your treadmill, you're at a level 4, go on up to a level 5 or 6, or just to see how much you can do, and then vary the interval or the intensity of it. Thank you for listening. This is Dr. Vanessa Allen from Natural Family Wellness.